Hi, good morning, everyone. Good morning and welcome. We are so excited to have you here today. My name is Peggy Wong, and I am all the way from California. It's my first time in Raleigh and North Carolina, so I'm really excited. My name is Peggy. I am a psychiatric nurse practitioner at the University of California, San Francisco. I work with amazing populations. I work primarily with women's health as well as geriatrics, and I am truly honored to be here today. Full transparency, I am very nervous, so if I stutter, please pretend I never stuttered. But it is an honor. I did write a little spiel to share with everyone today, okay? So I hope you don't mind that I may be reading on my phone, because if not, I would probably pass out from being too nervous. Okay. So it's an absolute honor to be here with you all today, hosting and being a part of the AAPI Youth Mental Health Center stage. This event is all about elevating voices that too often go unheard, sharing real stories, learning from expert insights, and engaging in healing-centered activities that reminds us that we are not alone. Your presence here truly matters today. Whether you're a student, a parent, an educator, a policymaker, someone in the nonprofit space, or an advocate for mental health, by showing up here today, you're already creating a huge impact. You are standing against stigma. You are showing our youth that the struggles are seen, their healing is valued, and their voices carry weight. Together, we are building more than just awareness, we are building community. Every story shared today, every conversation we lean into, every moment we choose to listen and reflect, helps create waves that extend far beyond this room. Waves of understanding, of connection, and of lasting change. So let's be present, let's be bold, and let's keep lifting one another up. Together, we can reimagine what support looks like for AAPI youth, and together we can build the future they deserve. Okay. I also have a co-host with me. His name is Dr. John Holton. Dr. Holton is the Director of Strategic Initiatives at UIC's Jane Addams College of Social Work and also serves as a WAVES advisor. In this capacity, he helps faculty pursue research funding and mentors graduate students by linking them to opportunities in policy development and implementation. Okay. So before I pass it to Dr. Holton, I do want to share our program book. This is the QR code you can scan. If you don't have a physical copy at your table, please go ahead and scan this book so that you know exactly what is going on today. And I will pass the mic to my wonderful co-host, Dr. Holton.
Good morning, everyone. Before Peggy sits down, let's give her a round of applause for that wonderful job she did. You can write speeches for me anytime. So good morning, everyone. I came from Illinois to Raleigh for the first time for this conference. And I'm here because this is so important, and I'm so delighted and proud to be a part of it. I want to introduce our keynote speaker in a second, Kelly Crosbie. And I am so excited to see all of you. You're going to learn a lot. You're going to meet amazing people. I encourage you to seek out the volunteers who help produce and make this happen. And before you ask me, what does a director of strategic initiatives actually do? I'll give you an idea. There's a film called Silent War that you're going to see. I'm going to help bring that film to the Jane Addams College of Social Work at the University of Illinois, Chicago, so that the students, the staff, the faculty, and the community can become more aware of the presence of the film, the importance of the film, and what they can do to support youth in Illinois and elsewhere. So, I didn't know I was going to do that until I got here, and I saw a wonderful resource, and I thought this should be shared. So let me bring up our featured speaker. Kelly Crosbie is a licensed clinical social worker, and she brings over 30 years. Well, Kelly, maybe we'll.
Oh no, we're switching
Oh, you switching, huh?
because she's the star and I'm like the intro.
Okay, okay.
Read Kelly's and then I'll just do my own.
Just think, we just met and we get along so well. In any case, she brings 30 years of leadership experience in public services, supporting mental health, substance use, and developmental disabilities in North Carolina. And would you like to say a few words? No? Or
What was that? No, no, yeah, I actually.
okay.
Yeah,
All right.
Maria's next. I'm so glad the mic doesn't work. So Maria's next. You can hear me, right? Okay. Thank you so much.
Sorry, Dr.
That's okay. And now, a round of applause for.
Good morning. It does work a little bit. Yes. Good morning, everybody. So this is a testament of how much we're family, right? That we can adjust even at 8:30 in the morning. And also, I want to take note that Peggy and Dr. Holton, I attended. I'm an alma mater essentially of each one. I mean, I went to Berkeley and UCSF. We did work with each other there, and I volunteered there. And I went to graduate school at UIC, so it's even more like family. Uh, So I do want to welcome you to Roots and Resilience. And it's such an honor for me to be here not only with my alma mater or my alumni or colleagues, but here with you today. And surrounded, as it was said, by teachers, advocates, researchers, educators, and most especially youth who are working towards the same vision, a future where every AA and HPI young person can grow up supported, seen, and thriving. Again, my name is Maria Cervagna, and I serve you as your North Carolina State Representative. Thank you. Professionally, though, and many people think I'm a poli-sci major, but as I was saying, I went to UIC, and I'm trained in epidemiology and biostatistics. So that is why today's gathering is even so important to me. It really resonates with me so much. This conference theme this year, the power of data and stories, could not be more timely. Too often, AA and HPI voices are missing from the conversations on mental health. When that happens, our children, our youth, even our seniors and adults, our moms and dads, our aunties and uncles, become invisible in the data and in the solution that flows from it. Today, we are saying about that, no more. This gathering is more than just data points and statistics. Though these are critically important, it is about human stories behind every number when we see it on a slide or a report. Every data point represents a child struggling with stress, anxiety, or depression. Every percentage increase or decrease represents a parent seeking help, schools working to support students, and communities gathering together to break stigmas and build hope. When we are together, and when we bring together state policymakers, community leaders, researchers, and most importantly, your youth voices, we're not just sharing information, we're shaping solutions, we're shaping the future. These solutions are not just theoretical. They touched classrooms, clinics, living rooms in every part of our state, but with everybody here that's from every corner of this country every corner of the United States. So as a legislator and a public health professional, I've seen firsthand how powerful it could be when evidence meets lived experience. Data provides the evidence base. We need to fight for funding, write strong policy, and hold systems accountable. But stories give us heart. And they remind us who we're fighting for, why we're fighting for, and why the work matters, even when it's hard. And it is hard. We were just talking about that this morning. And make no mistake, when this work is hard, we know in our community we can overcome that. Our youth are growing up in a world with extraordinary pressure, from navigating social media to facing rising hate crimes. We've seen it. It's not talked about a lot, but we know it's happening. And the bullying in our schools, like it seems unsurmountable. But, you know, it's not hopeless. You see that there's 300 people here, and that's just the people who could come, who could attend. But you know there's so many other people in the community who are fighting for you, who are here with you together. And gatherings like this reminds us we're not alone, and neither are they. So that is why state and community partnerships are so essential. We were just talking about that this morning. You were in my speech. We need collaboration across agencies, across sectors, across generations to build a truly supportive mental health ecosystem. Schools, faith-based communities, health providers, and policymakers must collaborate to ensure that youth have access to culturally responsive, affordable, and readily available care when it's in need. And I want to speak out specifically to the youth. You'll often hear adults say, "Oh, you're young. You haven't seen the world yet. You don't know." Don't let anybody tell you that. And don't let anybody tell you no, because you are facing such different adversities, such different joys too, than we ever have experienced. So your voice is so impeccably important, and don't ever let anybody silence you. So as you participate today, in the sessions today, I encourage you to be bold. Every single one of you. Ask the hard questions. Share your experience and engage and learn from everybody's experience that you're with. Challenge people. Challenge policymakers like me, and challenge adults and youth in the room, and have people feel open to be able to share. And I want you to leave here not only inspired, but having concrete ideas on how we can strengthen partnerships, close gaps, and create systems that every AA and HPI young person and everyone has a path to resilience and recovery, because we're in this together. We can't do this alone. So thank you for bringing your expertise, your passion, and your voice to this conversation. Your presence here is the proof that you can turn pain into purpose and into action. So I'm grateful to be here in your journey, and I look forward to working with you together. Thank you so much. Oh, yeah. And not a moment too soon, our keynote speaker today, I work with at the state level. I can't say enough words, and Dr. Holton gave you her professional background, but she is holding our mental health in the palm of her hands when it comes to the state of North Carolina, and he's considered an expert in nationally. So I'm gonna pass it on to Lily, Dr. Chen, because no. And it's an honor to say Dr. Chen, actually, right now, right? Without further ado, Dr. Kelly Crosbie, thank you so much.
Thank you. That was super, super kind, and it will be hard to live up to. And I will be honest, I sometimes have the benefit of being the only speaker or speaking after maybe less dynamic speakers, but that's a really, really hard act to follow, so thank you. Whew, I'll do my best after that, so thank you for that speech. But my name is Kelly Crosbie, and I have some prepared remarks, which in true form I will probably ignore, but I may look at them. I am the director of our Division of Mental Health, Developmental Disabilities, and Substance Use Services. It's a really big, long title, but I say it in totality because those are people. Those are literally people that our agency represents. And my job is to support the public mental health substance use and IDD system here in North Carolina. So what does that even mean, the public system? So it is our job, of course, first and foremost, to support people with services, supports, policy, who have Medicaid, which is the largest public insurer here in North Carolina, but also folks who are underinsured. And I would say, myself included, even those of us who have insurance, we have the privilege to have insurance, that's not public insurance, you are quite likely massively underinsured. So we support a lot of programs for the state like 988, which I'll talk about in a bit, but even our entire mental health crisis system is totally publicly funded. Other insurers don't pay for it. But there's actually a lot of services and supports that we pay for, all of us who are underinsured. That's another speech for another day, but really, really advocating for genuine mental health parity and genuine coverage of the services and supports that we need for all the people living in North Carolina is a really, really big deal. So that's sort of the scope of our responsibility. It's policy, it's funding, it's working with wonderful, wonderful legislators to write good law that protects and supports people to get as much funding as we can to support necessary services and supports here in North Carolina. And I will say that a lot of public insurers do look to us to set policy, and oftentimes they replicate things that we're doing in our public system. So it is a huge responsibility and an honor, and really, really proud of that job. So I want to talk with you a little bit more about that today, but a little bit more about me. I am a social worker. I'm super, super proud of that. People are really kind. People call me doctor. I am not a doctor. I'm just a good old social worker. I'm really proud of that. I'm not even a doctor in social work. But I'm a mom. I'm so proud of that. And I have a 14-year-old son. So, yeah, right? So conversations about youth mental health and making sure we have a system that supports wellness is deeply personal to me, right? Not just because of him, but because of my own experience as a young person who desperately needed tons of support and pretty much didn't get much of anything, certainly not formally. And I'm a person with lived experience, but hold that thought because I want to share a little bit about that later. Because first, I want to recognize a couple other folks. I don't know where they are, but Jerry's back there manning the 988 table. Jerry, where are you? Woo, Jerry! And Pooja. Where are you, Pooja? Thank you. And James. Yes. Thank you all for being here. I have a wonderful team. I'm so glad that they're here today. And Pooja and James in particular. No, Jerry, you're awesome. I'm just using Pooja and James to say they're actually part of a unit that I do want to talk about here today. So that is part of the way we're trying to rethink mental health in our communities and honestly do a better job. So thank you to them for being here. Thank you very much to UCA Waves and Lily, Dr. Chen. Lily, where'd you go? I'm really bad at, I'm sure it's diagnosable for all you docs in the room. I have a really hard time focusing in on things. Thank you, Dr. Chen, for just being you. I mean, everybody in this room knows what I just said, right? I just want to thank, not a week goes by that I don't get just lovely texts from Lily. You probably all get them too. I don't know how she travels so much. But I just want to thank her for welcoming us here today, welcoming me. I have so much to learn, and I want to do a good job, and I can't do my good job unless communities like yours, this community here, and people like Lily invite me in. And I don't take that for granted. I'm incredibly grateful to be here with you all today. I'm incredibly grateful that you all live here in North Carolina, that Asian Americans, Hawaiian and Pacific Islanders live in North Carolina. You bring wonderful things, wonderful things. I'm glad you're here. I'm glad you let me experience your culture sometimes, and I'm glad that you invited me here today. So I hope when I talk about our strategic plan and what we're doing in North Carolina, you can see yourself in it. But I encourage you to say, if you don't see yourself in it, tell me. Okay? We want you to be in it. But I understand I can't foist that upon you, nor would I want to. I'm asking you to hear a little bit about it, and hopefully it sounds okay enough to you that you're willing to partner with us on it, like Lily does, which I really thank her for. Okay, so let me talk about our strategic plan a little bit. You're going to hear a lot about data today. So we actually try to have a state plan in North Carolina. Sometimes I'll call it the strategic plan, sometimes I'll call it the state plan, that focuses on the needs of our state, the vision and goal for our state, it was created with folks, by folks, but it tells you exactly how we're going to spend our money and spend our time, okay? And it really focuses on some really fundamental issues in our system here today. We try to use data to inform that, right? So we use statistics that you're well aware of, like 1 in 5 AAPI youth probably has depression and anxiety. And we also know enough to know that that's probably an underrepresented number, right? Right? Probably know enough to know that. We also know, again, from data, please know, in no way am I representing my knowledge of the AAPI community. I'm just telling you the data that I see, and I rely upon you to tell me if it's right or wrong, right? That our AAPI youth here in North Carolina face unique challenges, right? Dealing with multiple cultures, things like racism and bias, even pressures within your own culture. We all have that in different ways. I'm going to tell you a little bit about mine, right? And those are all important things to lift up and recognize, but to recognize the fact that they're unique, right? They're unique. And so unique situations need more unique, customized solutions, right? And they need community partnership, which is my big punchline altogether. So we see this data, we see lots of other data in the state, and that's how we came up with our state plan. So one of the biggest things in our state plan, if there's anything I get across today, our number one goal, it will just shock you. It's everyone's number one goal. It's access. It's everyone's number one goal. But I would argue that we're trying to do access in really different ways. Really, really different ways. And so I think we have access problems. We talk about the classist access problems, right? We don't have enough licensed therapists, right? Trust me, we don't. And that's its own problem, right? Because we have lots of, I'm just going to be real blunt, we have lots of undertrained and underinformed people providing mental health care, which is a real problem, and it's created a lot of our issues. That's an issue. It is. But access is certainly more complex than having enough licensed folks. We will never have enough licensed folks. Never. Okay. I will start there. I will absolutely start there. Doesn't mean I won't try to get more, but it does mean we have to lean into communities and spaces where people feel more comfortable and equip those spaces. And I'm sorry. Oh, I just said I'm sorry. And I'm sorry that means more work for y'all. but that's okay, right? It is. So it means leaning into communities and spaces that aren't traditional treatment systems, right? And it also means the other big thing, and this is telling you something about who we're about. So it's leaning into community and supporting community and humbly joining with community and saying, I don't know your community, teach me. Here's some money. You do with it the right things for your community, right? And then it's also tackling stigma, right? And I am, when I talk about stigma, and I'll tell you about my story a little bit too, in my culture, where I come from. So when I talk about stigma, especially when I get really fired up, for people that know me, I get really fired up. I talk about ignorance and shame. Stigma is it's almost like so overused, we're desensitized to it. But it's true, it's a really big and awful word. And it's so insidious, especially for young people. I was at a conference yesterday in New York with Derek. Where's Derek? Derek, woo, right? And we were on a panel about youth mental health. And I said ignorance, I think, is our biggest structural barrier, right? Makes us create terrible policies. Makes us do terrible things to people with mental health issues generation after generation. We institutionalize, we criminalize, we arrest. With that in mind, how do you think parents feel when they think, oh my Lord, my child has a mental illness? Petrified. Petrified. We've not created kind of a safe structural space for people to say it's okay to have mental health issues. It is okay if your child is depressed or anxious and you notice and you talk about it, because there's help and support and you're gonna be okay, parent, and there's a great space in your community to go to and it's gonna be okay. So like, it's hard to get there when we have so much stigma and absolute ignorance about mental health, right? So in true vein of roots and resilience and storytelling, let me just tell you a story about my culture, right? My culture. So when I say I'm a person with lived experience, I was raised by a dad who had serious mental health issues, right? He's a veteran. He should have never gone. That's a whole nother story, right? What we do to really poor 19-year-old kids. That's another story, y'all. And so he saw terrible war. He probably was not in the best mental space to go in the first place. And then when he came home, he was really sick, and he had 3 kids under the age of 25. My dad got 0 formal treatment. And some of that, yeah, we lived in a rural community, so there was no access. Of course there wasn't access. But also he was a man. He was a veteran. He was a soldier, which is to this day, my dad's like 75, that's his only identity. That's still to this day. And he did a couple tours in Vietnam, but that's his identity, right? He was a soldier, he was a man, and he came from a community of faith and a really strong, even though we weren't allowed to use the word, German tradition. When you look at me, you're like, this is German. You know, we weren't allowed to call it that. We had to call it Pennsylvania Dutch. Deutsch, right? So we were Pennsylvania Dutch. I'm a whole lot of other things, like a lot of people too. You wouldn't know it, but I'm also Polish and Italian. If you ever met my beautiful mother, she's Italian. My sister, you wouldn't think we were related, but this is the German, right? You were stoic, you were strong, you did not talk about these things, and your faith needed to be really dang strong, right? So my dad did not get treatment, just didn't, for all those many, 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 many reasons. So he relied on the church. We didn't get help. It was really hard for us as kids. And of course, it shaped who I was. But stigma is huge. The next thing I want to say, I want to just give folks a little bit of warning. It's serious because it's going to mention suicide. So just want to give you a minute if anyone is okay hearing that. But I have a wonderful, wonderful, wonderful cousin, or I had, named Jeremy. We were the same age, born about a month apart. He was bright and lovely and charming and excelled. We were the sad kids. We were those sad kids over there, those Billings kids who had the dad. But he was charismatic and outgoing and absolutely lovely. And he died by suicide when he was in his early 20s, married and had a couple of kids. I do not know the struggles that he had with mental health. I have no idea. He kept them hidden really, really well. And here's the hard part of this story. When he passed away by suicide, I had well-meaning members of my family, I'm not sure how this is well-being, told my aunt that he was probably in hell. I can't kind of get over that, And now to kind of reconcile themselves, about 10 years later, they say it was an accident. It was just an accident. He didn't actually mean to take his life, and that's how they had to come to grips with it, to be okay. Just to be okay, because the thought of my cousin in hell was far too much for the family to take. I'm sorry that people take their own lives. It's tragic and it's horrible, and we've got to do a heck of a lot more. But that whole dynamic of like, he needed help and he didn't get it, and we didn't even know he needed help, and where would he have gone? He was a good churchgoer too, as was his parents. He went to a Christian school. Why didn't he get the help there? What kind of help did he get? When he died, it was a bad thing. It was a bad thing. It was a tragic thing, but it wasn't anything he did wrong. So there's just so much culturally, right, in that example of my family and my cousin that's just truly tragic. So that's hard. So culture, I know, plays a really big role in how we think about, address attend to mental health and wellness within our own families and communities. So with that being said, two of our big things around access are combating stigma and ignorance, but also working within communities. I know full well that because my family was so involved with their church, right, which had its strengths, which I will end with strengths, right, I promise. If they had had some education or knowledge about mental health, if the adults in that church, the teens in that church had had a space to talk about mental health, and it was okay to have those kind of conversations to talk about mental health and strength and wellness and to recognize signs of depression, have a trusted adult you could go to in that space, right? Because that was our space. It would have done a world of good. I can't ever imagine a scenario where my dad would have gone to formal treatment or I would have gone to formal treatment. I can't imagine. But in the community spaces where we were, that would have been extraordinary if we had equipped that community space right there, right? So trying to educate and break down stigma, but also trying to work in community with communities in ways that make sense to your specific culture. And that's why James and Pooja are here. And we've got, I always say Pamela's name wrong. It's not Pamela. Pamela. We've got folks working in the LGBTQIA+ community, the AAPI community, the Latina community, the older adult community, veteran community, because we know that a good old-fashioned standard treatment way is not the only way. It's not. It can't be. We will never get to people that way. So we need to get to families and community. And so that's part of our relationship with UCA Waves, which we hope grows and grows and grows. So here's the ending on the high note. I think I've gone way over my time. Oh, I have. Okay. Here's the ending on a high note. Was my family all bad? Of course. Look at me today. I was telling Derek yesterday, I always describe it as, I don't know what gene I have that I'm perpetually optimistic, no matter what's happening. It is. It's confounding. It's absolutely confounding. But it's just resilience. That's all it was. We went through really hard stuff. But I remember two people and several factors that made me a resilient person. The church wasn't all bad. There was great stuff. I was part of the youth club, and I spent all my weekends, this is a true story, helping the community. That was part of our job. It was service to the community. We helped older adults. We helped people with disabilities. We collected food. It was service to others. And that was a wonderful thing, and it was a strength. And I was actually proud of that, and I felt good about myself, and that was a strength. And the other thing was my grandma. She was extraordinary, extraordinary. She was a tough. Anyone who ever met her, she was kind of like Lily. They would never forget her, never. Her name was Elda Almeida. Good German name, right? Elda Almeida. No one has ever heard that name before. But she was tough and extraordinary. She advocated for my dad for treatment. She took care of us kids. She was always a safe place to run to, and I felt loved and okay because I had my grandma. She was strong. So leaning into family and leading into those leaders and wisdom. She'd gone through her own things, right? But she had wisdom and resilience, and she taught those things to me. So yep. Thank you. I'll just end with thank you. Thank you for having us. Thank you for letting me share. I know our cultures are not the same. I don't pretend that they're the same, but I understand how culture really affects who we are. But there's so many strengths, and we want to work with your culture in ways that make sense to you. So we're here to listen and learn. Thank you.
Thank you so much, Director Crosbie. We have something special to present to you, and everybody come up, the UCA volunteers and your staff, please. We're going to have Commissioner Stolling present something to you.
Whoa. Oh, thank you. You're sweet.